So maybe you could sort of just in a few words, few minutes, just each of you sort of define what your vision of supportive housing is, sort of bring it all together, tie it together for us. Let's start with Ellen and then Steve, Laura.
You know, I think we obviously have a lot more work to do, given the numbers of families and children and individuals living in the shelter system. So I think we can, you know, create ideal models and measure them and, you know, evaluate them 10 times over. But we really need to ramp up the supply. And I think the answer to sort of that future is in the Public Housing Authority. I think we've known that for many people in this room have known that for a very long time. And because we can't get our hands on it, we look for real estate elsewhere, and we'll go anywhere to find it. In our case, we stick to our neighborhood, but there are not that many places left. But we have the capacity to sort of manage, provide services, prevent people from being evicted in Washington Heights and West Harlem. We would know how to do that. We know where all the services are, health services, mental health services are, and we could really turn it around. But that would require access to those housing units that are presently controlled by the Housing Authority. And I know there are a lot of discussions, you know, but I don't think the supportive housing industry here really is at that table where those discussions are taking place, and where the property and the units and the scale we have collectively, we certainly belong there, but we'll probably end up with something like a set aside of somewhere or a piece of it. And I think where we could really make a difference together would be to be more assertive about taking a strong position in that discussion.
My big idea is that the government subsidizes housing in a lot of different ways, and so that we should just say there's going to be a set aside in every single project developed by anybody, for-profit, non-profit, community group, that if you're taking government money to build housing, you need to have some units set aside in those projects for people that have the highest need that are living in shelters, and that we can, and it won't require that many units. I mean, there are 30,000, 40,000, I mean, there's a number, but it's a number. And there's a lot of housing getting developed. There's going to be a lot more with the managed care coming down the pike, that we could be doing something that was, and we can know how to do those, deliver those support services, keep people in housing, connect them to community resources. So I think the provider community can partner with whoever puts the housing up to do that. I think there needs to be another model out there that, because all this housing is funded with tax credits, the amount of control and rigidity in terms of getting somebody into these units and filling out the damn 2010E and all that kind of stuff, that there needs to be this kind of a low threshold housing that used to be the flop houses. We can do a lot nicer job than that and take over. Used to be motels. It used to be places you could go, and that. And now that managed care companies might be on the hook for some of it, say, gee, for $100 a night, and I could have somebody into a nice place. That would really make a lot of sense. And so my idea is you could also have tourists in these places, because there's a lot of people who'll pay $100 a night. It'd be great. They would, you know, my adventure tourists. So that would be another thing we could do. And this is shameless promotion, but we have opened a respite center, which is a 2-week stay. It's a place people can go who are undergoing a psychiatric crisis of some kind, instead of going into a hospital, that this can be a solution. And what I'd like to see, much like starting daycare, is that if we had tons of these places, that people would never go into the hospital in the first place, and we start this cycle, because a lot of the work we do is repairing the damage that's happened of people cycling through hospitals and shelters and so forth, and it reinforces the poverty, it reinforces the trauma that people experience. And so if we can have a different kind of system where, and in New York, this is the last bastion of the hospital bed, and they're going to come down eventually. We just can't sustain them financially. under Medicaid forever. So there'll eventually be fewer hospitals, fewer beds, and that we need to sort of create other places for people to go that are going to take them on a path that's where we don't have to do so much hard work, 20 years later.
I have a lot of hope for supportive housing in the future. I think of supportive housing as a movement, not as an industry. I always cringe when Bill says that. I think it's dynamic. I think next year this conference is going to have to be at the Jacob Javits Center. We have, all of the ideas for the future are in this room because, we know the folks. I also want to say that I think the deep, I don't want to say professionalism, but I think the deep understanding and training of our staffs throughout supportive housing is really quite incredible and something to be lifted up, because we can house almost everybody in supportive housing in the community. And I think in partnership, which is also another funny word to use, but our relationship with government, with New York City government, is only becoming better. I mean, the 2010s get out, right away. Certainly there are other issues that I could discuss about placement. However, we are building a momentum with government. For example, we're all worried about the sequester. HPD called supportive housing providers together to talk about the effects of sequestration, to problem solve together. When we get ahead of HPD in some of our developments, they don't chide us. They just try to work with us and put us back on a track that they can go to their commissioner and the mayor and say this is going to work. I think we're really poised to house more people. Clearly the siting issue is a huge one, not so much because of the communities, because I think we have done a good job, certainly with the help of Shinny, in educating communities. It's really finding the property and putting the property aside so that we can build. So I'm hopeful. I think we've got a lot of great ideas. I think we know the folks who need the housing the most, and we know how to help them thrive and meet their measure of success.